I prefer 0% of my patients see a surgeon. Unfortunately, there are times where the structural complication is just too great for conservative measures. When this happens for me, and when this happens for you, what are our patient options? Now, today's blog is going to go through one patient option, which is surgical. While I'm not a surgeon, I have seen things in the last 15 years that have led me to believe that there are disc replacement surgeries for certain patient demographics that have had significantly greater results than cervical fusions. With that being said, find someone in your area, someone that you trust and your patients trust to make this differentiation between a cervical disc replacement and a cervical fusion. With that being said, what the studies are showing is that after a cervical replacement surgery, cervical disc replacement, those patients are having greater mobility, they're able to maintain their natural biomechanics better, they're able to have better clinical outcomes, not have bone graft related risk, have faster recovery, and what I think, personally, this is an opinion, they have reduced risk of adjacent segment disease. Now, I think that's the most important piece, because what we know about artificial discs is they have demonstrated the ability to maintain and not decrease the range of motion postoperatively for that level, and that means so much to those levels above it. And when you have a patient that gets a replacement surgery, a fusion surgery, we know that level above it is going to have problems. It's going to be bearing load that it's not supposed to be bearing. And these disc replacement surgeries are preventing that adjacent level disease. So, the blog today is going to go through the research behind that and provide some opinions and some facts. Also at the very end, I'm going to go over, there are some patients that unfortunately need to have a surgical referral immediately. We'll go over those options. And some patients that are maybe best dealt with in our office as far as conservatively before referring to a surgeon, which are the vast majority of patients, as we know. Take a look at this blog. Let me know your thoughts. Once again, as a provider, our job is not to treat patients. It's to evaluate patients. And those patients that we evaluate who fit well into our niche as far as conservative, non-surgical, non-pharmacological care when it comes to musculoskeletal problems, it's a big piece of the pie. But there are some people that fall outside of those constraints. And for those people, a surgery may be needed, and I hope this blog helps.